Hi guys, what's up? In this video we'll focus on something called diabetes mellitus. So first of all, what is diabetes mellitus? Is a metabolic condition characterized by high blood sugar level, or what you call hyperglycemia. It can be of several types depending upon what various factors. So here we have etiological classification of diabetes mellitus: type 1 diabetes mellitus, type 2 diabetes mellitus, other specific type, and gestational diabetes. About type 1 diabetes mellitus, immune-mediated and idiopathic. About other specific type, like what you call genetic defect of beta cell functioning, genetic defect of insulin action, or drug-induced like glucocorticoids and thiazide, or associated with genetic syndrome like Down syndrome and Turner syndrome. And on the other hand, we have what? Gestational diabetes mellitus. Okay, here we have diabetes mellitus, which is a type of diabetes in which an imbalance of pancreatic hormone occur. So diabetes can be what we call further divided into most commonly type 1 and type 2 diabetes. When on the other hand, we have what? Diabetes insipidus, which is the kind of diabetes that happens due to what? Imbalance of pituitary hormone. And the fourth one, we have what? We have a temporary type of diabetes, which is termed as gestational diabetes, but it can be prolonged if not taken care of. Hyperglycemia can cause both acute and long-term problem. Acutely high sugar and lack of insulin result in marked symptoms, metabolic decompensation and hospitalization, while chronic hyperglycemia is responsible for diabetes specific microvascular complication affecting eye, retinopathy, kidney, nephropathy, feet, neuropathy. Generally, diabetes is a long-term disorder that results in which your blood sugar level is rising above the normal range, so leading towards the complication. Diagnostic criteria for diabetes is what? A fasting plasma glucose of more than equal 126 milligram per deciliter, or what? Glucose 2 hours after oral glucose challenge more than equal 200 milligram per deciliter. If untreated, carries a significant risk of microvascular disease, in particularly diabetic retinopathy. So there are two hormones known as glucagon and insulin, are produced from the alpha and beta cell of pancreas. So let's focus on the first one, which is glucagon. Glucagon increases blood sugar level while you're eating or fasting. So it converts carbohydrate from the food to glucose and breaks down what we call glycogen into glucose. Thus, in both conditions, blood sugar level is rising. On the other hand, we have insulin. Insulin is what you call responsible for lowering your blood sugar level. When there is enough glucose in the bloodstream, beta cell releases insulin and converts it to the stored form glycogen and goes to the liver, muscle, and adipose cells. So diabetes mellitus is a chronic disease and has two types. One is type 1 diabetes mellitus, also known as insulin-dependent diabetes mellitus, IDDM for short, and it's also called juvenile diabetes, and it accounts 5 to 10% of all cases. So here in this condition, autoimmune, it results from what? Autoimmune destruction of beta cells that are produced insulin. So here, insulin isn't produced by the body, so you must take it artificially. The common symptoms are what? Increased infection, fatigue, and rapid onset of weight loss. So here the peak incidence of this type 1 diabetes is what? 10 to 15 years of age. The second one, which is called type 2 diabetes mellitus, is also known as non-insulin dependent diabetes mellitus, NIDDM for short, and it accounts 90 to 95% of all cases. So it's common, and it's also called adult onset of diabetes, and it results from genetic and environmental other risk factors like diet, obesity, and age. Okay. In this type, insulin is produced from the beta cell, but it's either insufficiently or ineffectively used. Okay, so muscles are unable to deposit glucose, and your body becomes resistant to the insulin produced. So thus, blood sugar level is rising. The common symptoms are what? Blurry vision, dry, itchy skin, slow healing wound, what we call fatigue and loss of feeling in your feet. So usually urine contains sugar in the diabetes mellitus. So here we have diagnosis for diabetes and pre-diabetes. So diabetes is confirmed by what? By what we call plasma glucose in random sample or 2 hours after 75 gram glucose load more than equal 200 milligram per deciliter, or fasting plasma glucose more than equal 126 milligram per deciliter, or HbA1c is more than equal 48 millimole per mole. People categorized as having pre-diabetes have blood sugar level that carries a negligible risk of what? Microvascular complication, but are at increased risk of what? Developing diabetes, because there is continuous of what we call risk of macrovascular disease, and with increased glycemia in the population. So pre-diabetes, so those population with pre-diabetes must have an increase of cardiovascular disease, also like MI, stroke, and peripheral vascular disease. Also, the traditional way to diagnosis of diabetes and pre-diabetes has been by using random or plasma fasting plasma glucose or plus minus oral glucose tolerance test. Okay, but in the 2011 WHO advocated as of the what we call HbA1c to diagnose diabetes. So diagnosis of diabetes is simple, based on confirmation of hyperglycemia either by fasting or random glucose, or what we call OGTT, oral glucose tolerance test, or HbA1c.